Uganda has received a lot of aid in several areas. One of them is in the health sector. Every year, billions of dollars are offered to the government of Uganda to improve various aspects of the health sector, including human resource, medicines, equipment, and research, among others. The low staffing levels, especially for the hard-to-reach areas, have been a challenge for the health sector for a long time. However, Uganda is generally not short of health workers, but poor attraction and retention has led to a shortage of those to provide health services to Ugandans. The country still requires over 5,000 health workers to fill various vacant positions, including nurses, nursing officers, consultants, among others. Filling some of these positions has been made easier by aid from the American government, which is geared towards improving human resource in the health sector.
The Ministry of Public Service and the Ministry of Health and Ministry of Finance, local government, we had an interministerial committee, which interministerial committee was on issues of recruitment. We in 2013 had a general recruitment exercise, and we were emphasizing mainly health center 2s and 3s and 4s. We were emphasizing 3s and 4s. And after that recruitment, we got some money from finance. We recruited some staff, a big number of staff, but still gaps remained. And the funding still was not enough. As a result of that, we continued getting PEPFAR money to support more staff in these health facilities, both government and the PNFPs.
Badiru also explains the kind of health facilities that have benefited from this 5-year project.
The earlier one, we were concentrating more on government facilities, but later on we went into work with the PNFPs as well. So when you look at the PEPFAR contract staff, they are both in government facilities and private, not for-profit facilities, that is the faith-based facilities. Presently, the ones we have are in the Catholic Medical Bureau facilities, Protestant Medical Bureau facilities, and the Muslim Medical Bureau facilities.
Priority in recruiting was directed towards the epidemics that had ravaged the nation at the time.
When we started the cadres, those cadres that are rare in the health sector, and those cadres that handle patients in line with the HIV/AIDS mainly, then malaria and TB. So the cadres we have medical officers, we have the nurses, we have midwives, we have laboratory staff.
Whereas the agreement between the US government and Uganda was to have all the 2,670 health workers under the PEPFAR contract recruited, 6 years down the road, more than 900 have not found placements.
Shortage of wage, insufficiency in funding. Otherwise, if there was enough wage, all these people would have already been absorbed.
Government, through the Ministry of Health, has been working to improve the health sector, especially meeting the required standards of the staffing levels. But refugee hosting districts are now urging for a restructure in the systems because of the big numbers of people seeking healthcare services at the referral hospitals due to an influx of the refugee numbers. The district health officers in Yumbe, Arua, Zombo and Ajumani district say this has undermined the staffing norms even when they are way above the acceptable levels.
As we speak now, with challenges of increased attendances in the hospital, in 41 health facilities in the district. We have constraints of space, we have equipment that cannot cope up with the numbers we have in place, and we have staff that have to attend to more people than the staff to client ratio. So in terms of human resources for health performance, whereas, as I mentioned earlier, according to the staffing norm that we have, that was approved over 10 years ago, we are performing at about 92% of all approved positions filled. These positions, the staffing norm, first of all, was relevant over 10 years ago. Two, the staffing norms did not take into account the influx of the refugees. Therefore, with the influx of refugees to the district, we expect the staffing norms to be reviewed.
Because when we are comparing the denominator, that is quite old. Denominator, that's quite old. If we were comparing this after restructuring is done, then it will add more value.
The referrals from Bidibidi, they end up in the district hospital or in the health center 4. So we saw an increased rate of referrals to these facilities, and yet the hospital, the health center 4s have limited capacity in terms of space, in terms of medicines, in terms of human resource. So it brought a lot of constraints in the beginning. We were really stretched to the limit.
We are highly limited by the fundings, which is not very adequate, and the annual analysis which we did gives us a funding gap of around 256 million.
These are some of the repercussions of failure to absorb all the health workers as agreed 6 years ago.
The delivery system is constrained, may be constrained in case these people are not there. This is 6 years down the road, we are still absorbing. And I can't tell whether anytime the resources may stop, but what I know is that the priorities in the area of human resource is, as per USG, they are reducing.
Uganda has been praised for its open-door policy to refugees, but the effects of being a major refugee hosting country is now biting hard, especially among the host districts. Walter Mwesije, NTV.